What do you like to use for local? How do you numb up the nose?
Well, there's this thing called TXA, and I gotta, it stands for, I'm gonna butcher the tranexamic acid.
Is that for nosebleeds? I think I've had the ER use that for nosebleeds, maybe.
Yeah, so it's basically like a prothrombotic medication that will, impact, and I'm not smart enough to tell you where. Let's, get a real doctor here, but basically, it impacts the coagulation cascade and promotes some of the like clotting. So I'll mix that in like 2 or 3 mLs of plain TXA with Lido with epi, and I'll use that to inject like the soft tissue envelope of the nose. It really cuts back on a lot of the swelling, like a lot.
Interesting.
Like if you go back to my Instagram and look at my on table results when I was first, like a couple years ago when I wasn't using it, to my on the table results with it, you'll see it's just a barely any swelling. And then after I do my kind of osteotomies, lateral osteotomies, I'll inject pure TXA just to kind of help those. It's the orthopods use it. That's where, we
Hmm.
got it from, is they'll use it for joints and stuff, but it helps reduce the amount of bleeding and it helps reduce the amount of swelling. You got to be careful not to, there's some strict contraindications, people with cancer, people with clotting disorders, things like that. So definitely, take your time in figuring out which is the right patient to use it for. But now people are using it for facelifts, neck lifts, rhinoplasty, and now, do it for, nasal fractures and stuff like that.
Interesting. Yeah, I had only heard of it for like an epistaxis situation. Which is why I didn't realize that that's the same TXA you were talking about for, injections and local. But it makes sense now that you're talking about it.
Sinuses and stuff. Yeah, I'll
Yeah.
do it for sinuses. You can give it
Cool.
IV, not even just local. You can give it IV. It's like 1 mg per kg.
Oh,
IV, and sometimes if I don't give it and or the anesthesiologist hasn't given it, I'll be like, hey, I'll notice like a lot more bleeding, and then I'll like, can you give some TXA, and then the oozing will stop. But
interesting. So for your sinus surgeries, you're doing the TXA IV, not like topical on a
IV, yeah,
pledget or not
yeah,
injected
yeah.
directly. It's IV. Okay.
Well, IV. Lately I've been experimenting with it on the pledget. I'm like going crazy with the TXA at the surgery center. They're like, you put this thing in everything, vitamin TXA. But I've been
Like
doing it with pledgets too.
bacitracin back in the day.
Yeah, exactly. But it's worked really good, and yeah, it's like get some of that vitamin T.
What do you say again? Like when you mix it with your local, what's your how
So
much do
it's
you do?
basically 2 mLs of plain TXA or 3 mLs to 7 to 8 mLs of lidocaine with epinephrine, 1 to 100,000.
Okay,
1%
1%. So
Lido?
yeah, 1%. Yeah.
cool.
You just want to dilute it out so you're not like over injecting with like a prothrombotic agent into the nose.
Right. And you feel like your post-op there's less swelling, less edema.
Oh yeah, I mean, even just like when I do like the osteotomies, people would come out like even 3 or 4 days later with just ballooned and just blue, and like they hated me. And now I'll do the TXA, and they come to me a couple days later, and they just have like these little kind of like blue marks under their eyes. It's
Awesome.
been great.